Sir, thank you, Mr. Taylor and Mr. Berry, for this invitation. My background a little bit, I am a full-time farmer in Brenham, Texas. I'm also the past president of the Texas Organic Farmers Association. The last 5 years I've been organizing some of the largest sustainable and organic ag conferences in the state. And I'm also a farmer's market manager, and I feel like I'm got a good pulse on what's going on in the local food economy. I've been deeply involved with it, like I said, the last 5 or 6 years. But there's some things that really concern us, and also 13 farms that I'm deeply involved with in Washington County. My background also, I sell direct to customers, the largest community-supported agriculture program in the city of Houston. And we sell direct to our customers. And the question was, do we leave these solutions in the hands of Congress? I think that we need to leave it in the hands of the people. When we're selling direct through our farmers markets or to our customers, all that stuff is already currently being regulated through county health inspectors. And again, with the concern about traceability, this is the ultimate traceability. We're selling direct to our customers. If we were to get someone sick, we would immediately know about it within an hour. That's the kind of traceability that you guys are trying to get established in the industry, but we already have it in the local food economy. Traceability is already there. But some of the things that concern me, besides vigorous domestic inspection and the talk of standardization and level playing fields, the cost of this testing, and what I understand with the Senate bill and the House bill that's already passed, is that re-inspection would be at our cost also. I mean, you can literally regulate people out of business just with the cost of re-inspection. And then these record-keeping obligations is what puts small business, it's what threatens small business, is the record keeping. I have no staff. My farm is operated by my family and my wife. Just like any small business owner, we wear multiple hats. I'm probably going to be in the doghouse for the rest of the week, so I had to leave my wife at the heat of spring to come down here today. You know, if farmers are going to be more involved in this, we need to have meetings like this in December or in August or during the downtime in Texas. I was surprised just finding out within about 2 weeks that this meeting was going to be here. A lot of solutions have been talked about, and I want to emphasize some of the other ones. Is that, like I said, local health inspectors are doing their job. I don't know of any, I haven't heard of any food-borne outbreak coming out of any of the farmers markets in Texas. I don't know about it occurring anywhere else in the country. And I would like to emphasize also training is one of the solutions. Getting our extension office more involved to do food safety training with our farmers. But there needs to be exemptions, and exemptions do work. When farmers are selling direct to the end user, and when that food is traveling less than 250 miles, we are minimizing the risk. That is 1% of the food, less than 1% of the food consumed is coming from local sources. So the need to prioritize what those risks are, this 1% should not be the priority of risk. It should be the exemption. Even though my wife and I were figuring out, even though we have the largest CSA serving the Houston Metroplex, we're serving 1/1000th of 1% of that Metroplex. We are not a risk for the public health. Anyways, thank you again, though, for this invitation for us to be out here today.